Good afternoon, my name is Adriana Bringas and I'm going to talk about how positive psychology has impacted mental health. So to start, mental health is something that's been around for a long time, since the beginning of time actually, and positive psychology has given mental health a whole new meaning. So instead of being focused on what's wrong with someone, they've been focusing more on what is right and how to maintain it. So this is something that actually is near and dear to me because I've been suffering from anxiety since I was about 11, and it's been really hard. I always felt like I was trapped in a bubble and it was difficult to cope with, but after taking psychology and majoring in psychology, not just for my career, but for, a better understanding of why I'm the way I am and how the brain works and all that kind of stuff that I've always found really interesting. It's really helped me understand my mental health illness a lot better and how I can improve it. So to start off, positive psychology has given mental health a whole new meaning. It's shifted again from what is wrong to what is right. And throughout history, mental health was often viewed as a sort of religious punishment or demonic possession. So people usually thought it was either bad karma or you were a bad person and you deserved it, you did something wrong. And it was actually the ancient Egyptians, the Indians, Greeks, and Romans who believed in this. So during the Middle Ages, there was a big stigma to mental health illness, and that stigma carried on for a while. And Hippocrates was actually the first person to treat a mentally ill person with techniques that focused more on changing their environment and providing them with medicines. But again, the negative views still stuck even through the 18th century, and there was still a stigmatization that involved degrading and unhygienic confinement for these people. Dorothea Dix was the leading pioneer in lobbying for better conditions for those suffering from mental illnesses, and this led to the institutionalized inpatient care model. So this allowed for patients to live in hospitals and be treated by actual trained professionals instead of just being thrown into a room and kept away from everybody. In the mid-1950s, there was a push for deinstitutionalization and more of an outpatient treatment. So as opposed to the asylum-based kind of mental health care system that was in place before, they were moving more towards a community care-based healthcare system. And this allowed for patients to have a better improvement in their quality of life. Fortunately, there have been many breakthroughs on ways to treat mental health illness since then, and the field of positive psychology has opened many doors and given us a better understanding of the way the human mind works and how we can improve these kinds of things. So positive psychology steers away from the disease model and more towards not just building health, but maintaining health. Professor Martin Seligman, is considered the father of positive psychology. He became the president of the American Psychological Association in 1998, and when you're president, throughout that whole year, you focus on one topic or theme throughout to focus your studies on, and he brought in a rebalance of psychology, which is known as positive psychology. So he realized that up until that point, psychology focused too much on fixing problems regarding mental health and relieving suffering and making people less unhappy. And the idea at that time was that helping someone feel less depressed or angry would help them feel better and be more happy. But he believed that just because you're not sad doesn't mean that you're happy. So he brought up three main areas of focus into the field of positive psychology. The first was positive experiences or positive feelings, and this involved happiness, flow, well-being, optimism, and positive emotions. The next area that he brought in was positive traits that we can develop. So this would focus more on your talents, your creativity, your interests, your values, your character strengths, and your sense of purpose to improve your mental health. And the final main area that he brought into positive psychology is positive institutions. So this focused on family, organizations, your school, your businesses, and your community, and how they can affect how you feel and your positive emotions. Now that we have a better understanding on mental health and what it used to be and what positive psychology is today, I'm gonna explain or explore some ways that it's that positive psychology has impacted mental health and how we can actually use different techniques to improve our own mental health. So, positive psychology has proven that health is more than just the absence of illness. It's explored different ways in which we can promote well-being. It's produced an evidence-based intervention, and it has improved a lot of people's well-being. It focuses on a patient's own goals and strengths alongside with some interventions and clinical practices. So it's not just one specific way to go about tackling a mental illness, it's all these different components that come together to attack it, and it's become more of a societally focused approach that's being practiced today. Just a few of the benefits that positive psychology and ways that you can improve your mental health involve changing the way that you think. So you don't have to be happy all the time, but you should try to be a little bit positive whenever you can. For example, you can look at your achievements, your goals, your strengths, and try to incorporate that into your traditional therapy and treatment. You can ask for professional help. That is probably one of the most important things you can do. It's easy to go online and look up all these different things, but it's a lot better to go to someone who actually knows this information a little bit more and can definitely help you a lot better. The main focus of this is so that you can tell your professional health person or psychologist, what's wrong and like where you want to be and what you want to get out of treatment, and that can specialize or specify the treatment more personal to you, so they can focus on you and how it helps just you, not everyone else. Everyone else helps or focuses on their mental health or treats it in a different way because everyone's different. And finally, you need to accept your mental illness. That was something that I personally struggled with myself, but after getting some help and some research and understanding it a lot better, I was able to accept it and be like, okay, this is what's wrong and this is how I can help myself. So I've gone to treatment, I've taken medicine, done research, and now I'm majoring in psychology, so I have even more knowledge of what's going on in my brain, and it's definitely helped with understanding what's going on and being able to manage my symptoms. So again, in conclusion, this presentation talked about mental health illness, but more specifically how positive psychology has shifted the way that we view mental health illness, and I discussed different ways that positive psychology has done that and some different techniques that you can use to improve your own mental health. That basically concludes my presentation, so thank you so much for watching.